Hey, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes. Going to continue on, of course, with the EMS Quick Study Tips, and this is episode 16. Still in A&P, but we're getting more, again, into some of the meat and potatoes of the EMS Quick Study Tips and stuff that you'll find you'll be using much, much more out in the field. Of course, I like to, kind of highlight why this stuff is important, not just for exam prep, where you can remember some of this key information when you're looking at EMS questions and answers and stuff on an exam, but also when you are doing your patient assessments, when you're doing your documentation, and when you're doing your presentations to nurses and doctors to help you better, relay the information to them, knowing some of these key elements and knowing, what it is that you need to understand at the very basic level to do it professionally and properly. Okay, so I want to go ahead and today talk about the digestive and gastrointestinal systems. And again, this is a quick overview, right? GI tract and digestive system, we can go on for many, many hours, focusing just on certain organs themselves and what they do and how they, intertwine with everything that goes on in the abdominal and how that can relate to other areas of the body, right? So just keep that in mind. It is a very quick overview, and we're talking about pretty much the solid organs or hollow organs and the abdominal quadrants. So your solid organs, of course, we've got your liver, the spleen, pancreas, your kidneys, and your ovaries if you are a female. And if hollow organs are your stomach, your intestines, both your small and large, your gallbladder, your urinary bladder, your uterus if you're a female, and your ureter. Okay, so these are your hollow organs and solid organs that you need to know. Again, there's other areas and other organs that might be involved, but these are the main things that you are going to most likely see on many, many exams, and you're going to want to know when you're asked questions as far as what might be a solid organ, what might be a hollow organ, to be able to list these different organs and which one is solid and which are hollow, okay? So your upper quadrants, your right upper quadrant contains your liver, your gallbladder, your kidney, large and small intestines. Now your left upper quadrant also contains your kidney and your large and small intestines, but this is where it differs, where you've got your stomach, your spleen, and your pancreas in your left upper quadrant as well. Now your lower quadrant pretty much contains the same thing if you look at it here, right? Both have more of your large and small intestines, both have uterus for females, the urinary bladder, and your ureter, right? The difference is the right lower also has your appendix. Of course, we always know that the pain, lower quadrant pain, can be the appendix, the appendicitis, right? And also contains your colon. Now, some things to think about. I'm going to wrap this up. Again, this is a very quick Monday Minute, but we're going to wrap this up by just sort of highlighting a few things here, okay, to kind of help you out a little bit when you're taking your exams and thinking about solid organs, the things that you want to worry about with this. And a lot of the main problems you're going to see are injuries to the solid organs, and what will end up happening most of the time will be bleeding. And your hollow organs, when you have injury, the result is often the peritonitis, okay? Now, one thing that I do for myself when I talk about thinking about your quadrants and left and right and all that, to remember where everything is, this is something that I use, and I'm hoping maybe this can help you. A quick recall, I think of SSP in your left upper quadrant. Okay, so SSP on the left upper contains your stomach, spleen, and pancreas. The reason why I do this is because if you look back, okay, your lower quadrants pretty much contain the same organs, right? The same structures, besides the appendix, which should be pretty easy to remember that that's on the right lower side. But you look at the upper quadrants, right? Everything is pretty much the same. You still have your large and small intestines and all, but to remember I say SSP because I think of it on the left side, and I think of the SSPs being your stomach, spleen, and pancreas. And I remember, okay, that's on the left upper quadrant. Everything else is going to be on the right side, which is your liver and your gallbladder, and then the other structures are pretty much in both sides. And the same thing with the lower, the structures are pretty much on both sides as well, with of course, the exception of the appendix. That's the way that I think of it. If you have something that works for you, of course, use that. But if you've been struggling with trying to recall this type of stuff, think of SSP on the left, okay? And I think that might help you remember stomach, spleen, and pancreas, and knowing that's on the left side, and that everything else is going to fall on the right side. And as far as your appendix, and also knowing as far as your lower quadrants, where pretty much the organs are all pretty much the same. Okay. Again, this is the way that I think of it, the way that I look at it. If you have a way that you find easy, by all means, of course, use that. This is more for people, I think, who are kind of struggling with recalling where these organs are and always trying to think what's on what side and all that. Okay. So remember go back, guys. You have to look at this again and look at your solid organs. Look at the hollow organs. Okay. You're gonna see this stuff on exams. Okay, without a doubt, you will be asked what's this, listing of solid organs, a listing of hollow organs. Okay, and they'll put things in there. They'll say what's a solid organ, and one of the choices might be liver, spleen, pancreas, bladder, right? And try to trip you up a little bit and make sure that you're reading the answer choices. Make sure you read every choice. You start seeing liver, spleen, pancreas, and okay, those are solid, but you don't read all the way through. At the end of the choice, it says urinary bladder. Then you know that somewhere along the line that's the wrong answer. So read each answer in its entirety to make sure they don't throw in a hollow organ with the solid or a solid with the hollow and try to confuse matters a little bit. Okay, so keep that in mind when reading your questions and reading your answers. Okay, so again, go back, look at this video if you have to. Brush up on the hollow versus solid. Brush up on your quadrants. Okay, maybe you can use that SSP when it comes to remembering what's in each quadrant. Okay, and help you with your exam. Again, guys, these are basic, key elements, key points. What these organs do and how they relate in the body. Of course, we'll be going into them in some specifics as we go on and get to different areas of the body and different illnesses as we go on with these Monday Minutes. So I'm not going to each one right now. It would take much, much longer than the videos are intended to be. Okay, guys, next time we're going to be talking about fluids and electrolytes, getting into that. It's going to be part 1 because there are a decent amount of content with that. So we're going to get into fluids and electrolytes and pretty much probably go up to where we start talking about pH balance and stuff like that. Okay, so that's it for this week's Monday Minutes. I hope you can use them. I know it's quick, but again, these are key elements that I want you to know and I want you to understand going into exams. These are the things and the content you will see on EMS exams. Okay, I can guarantee you that you will see these. Okay, so knowing these key elements is going to help you pass the exam, and I'm hoping in addition to that, if you are confused and you're not sure and this doesn't make sense to you somehow, you'll either send me an email for some clarification, or better yet, you'll go ahead, crack open that textbook, look online, do some research, and better understand what I'm talking about. This is going to make you a better provider overall, increasing that knowledge base. Okay, so I hope you can use these Monday Minutes, guys. Of course, you can send me over any suggestions or questions or comments. My email is contact@emsofficehours.com. Guys, if you do like this stuff and you find that these quick tips do help you, I encourage you to go check out the EMS Quick Study Guide. Now that I'm getting more into some of the more topics that I think people are kind of understanding are more useful on a day-to-day basis in your EMS examinations and on your patient assessments and all that, people are finding that these quick tips are very, very useful. The last time I did this, the last week's video, we talked about the respiratory system, and I had a lot of people take advantage of this quick study guide, because I think they're starting to see that there's more to it than just medical, legal, and stuff like that. There's a lot more content involved. So a quick study guide like this, again, this breaks down that big textbook you have into about 100 or somewhat pages that really covers the key elements of EMS exams, and I think will lead you to more studying in areas that you're weak in, get you to understand things that maybe you were having a little hard time sort of connecting. Okay, and I really think this is something that's going to help you out. And I've said this before as well. this is something I've used before each exam I've taken over the many, many years that I've been doing this, and I find this guide to be pretty much invaluable. I can always turn to this as a last minute study guide to sort of I usually use it at the beginning of my studies before I take the exam, and at the end. In the beginning, letting me know things that I've forgotten or that I need to brush up on, and at the end to make sure that I understand the key elements before I go into an exam. So check it out. I think there's more information if you click here, going over to the website. You'll get more information about this quick study guide, and you can download it to your computer, and it's yours to keep forever once it's there. Okay? All right, guys, as always, I hope you enjoyed this. Questions, comments, again, the email is contact@emsofficehours.com. Be sure to go join me on Facebook at the EMS Office Hours Facebook page. It's facebook.com/EMS Office Hours. I hope I see you either there, or I'll see you in my members area as well when I send out communication to you guys also. All right, so that's it for me. As always, Jim Hoffman for Monday Minutes and the EMS Office Hours. Stay safe.